Hey everyone, welcome back to all my listeners. Now, I hope you're all having a great day so far. I know I am. And if it's your first time finding me, thanks so much and welcome. Welcome to my 6th episode of Season 6. Today is Wednesday, June 8th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, guess what, you guys? I have been graciously invited to my good friend who I just interviewed last week on my podcast, Betty Hovey. She has a LinkedIn live broadcast that starts at 6 p.m. Central Standard Time or 7 p.m. Eastern Time this Friday, June 10th. So I'm so excited. We're going to be talking about networking, which I know I've talked to so many people about. It's incredibly important. So I can't wait to be on a guest panel for her, along with my good friend Brian Quee, who happens to have his own podcast as well. He also makes TikTok videos, YouTube videos. He is the medical coding geek, super friendly. He's a rock star. I love Brian Quee. So he will be on the panel. And then there's my good friend Christine Hall, who is so smart, so savvy. She is the business owner of her own consulting company, Sterling Solutions, down in Florida. She's great, and I can't wait to talk with her as well about networking. And then finally, there is Vanessa Moldovan, who will also be featured on this panel, and we'll all be talking about our insights and our experiences on networking in this particular little niche of medical coding, billing, and compliance over all of these years, and how we all got started, what we're planning on doing with our lives in the future as well. And of course, we want to give back to our community and help bring up the new billing professionals, the new coding professionals, and the new folks in the compliance space as well. So I'm super excited. If you can hear it in my voice, I can't wait for doing this on Friday night and supporting my good friend Betty Hovey. So I'm excited. But anyway, you guys, today I'm going to be diving into my compliance tip, and let's take us back again to our back to basics with Ophthalmology Services. And that's right, it is the second Wednesday of the month, and that means I'm going to be featuring my very newsworthy update on the OIG Work Plan for May 2022. And I go ahead and close out today's episode with some inspirational words on vision and leadership from the great Italian artist, Michelangelo. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help all of you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy. Now, it's the second Wednesday of the month, so that means even in Season 6, I'm going to be going over the month's OIG Work Plan updates for May 2022. Now, the first OIG Work Plan update for May 2022 is titled Follow-Up Review of Inpatient Claims under the Post-Acute Care Transfer Policy, or PACT. Now, this review is coming from the Office of Audit Services. Medicare makes the full Medicare Severity Diagnosis Related Group, or MSDRG, payment to a hospital that discharges an inpatient beneficiary to home. However, for certain qualifying MSDRGs under the Post-Acute Care Transfer Policy, Medicare pays hospitals a per diem rate when an inpatient beneficiary is transferred to post-acute care. The per diem payment cannot exceed the full payment that would have been made if the beneficiary had been discharged to home. Now, a prior OIG review identified Medicare overpayments to hospitals that did not comply with the post acute care transfer policy under 42 CFR Section 412.4C. OIG's review found that the CMS Common Working File or CWF edits that were detected in patient claims under the post acute care transfer policy were working appropriately. However, some Medicare contractors did not receive automatic notifications of improperly billed claims, nor did they act to adjust those claims. And as a result, OIG recommended that CMS recover the identified overpayments in line with its policies and procedures and ensure that the Medicare contractors are receiving the notifications and are acting to recover the overpayments. CMS concurred with all of OIG's recommendations and detailed how they were being addressed. This follow-up audit will determine whether CMS's Common Working File edits are working properly in detecting inpatient claims under the post-acute care transfer policy and are automatically recovering overpayments, and whether Medicare contractors are receiving the automatic notifications and acting to recover overpayments. This final report is expected in fiscal year 2023. Now, the second OIG Work Plan update for May 2022 is titled Medicare Part B Add-on Payments for COVID-19 Tests. This is coming from the Office of Audit Services. Laboratory tests are critical for early detection, diagnosis, monitoring, and treatment of disease. Effective testing for COVID-19 is essential to slow its spread by identifying those with the virus and enabling treatment or isolation. On October 15, 2020, CMS announced actions to incentivize prompt COVID-19 test turnaround times by paying more for expedited results. CMS has identified that timelier test results benefit individual patients, their immediate communities, and the public at large. Starting in 2021, the amended administrative ruling under CMS 2020-1-R2 lowered the base payment amount for COVID-19 clinical diagnostic laboratory tests, or CDLTs, that use high-throughput technology to $75 in accordance with CMS's assessment of the resources needed for those tests. The amended ruling also established an additional $25 add-on payment for a COVID-19 clinical diagnostic laboratory test that uses high-throughput technology if the laboratory does these two things. Number one, if the laboratory completed that test within 2 calendar days or less, and number two, if that laboratory completed a majority of those clinical diagnostic laboratory tests by using high-throughput technology in 2 calendar days or less for all of their patients, not just their Medicare patients, in the previous month. Now, for this audit, OIG will review providers' supporting documentation for the COVID-19 clinical diagnostic laboratory test add-on payments to determine whether the documentation complied with Medicare's requirements. This final report is also expected in fiscal year 2023. Now, the third OIG Work Plan update for May 2022 is titled Accuracy of Falls Reporting in Home Health OASIS Assessments. Now, this is coming from the Office of Evaluation and Inspections. In April 2022, CMS will begin publicly reporting on the Care Compare website the percentage of patients in home health care who fell and endured major injuries for each home health agency, or HHA. Now, home health agencies report falls in patient assessments using the Standardized Outcome and Assessment Information Set, OASIS. And CMS reports the agency fall rates calculated from these assessments. In this particular study, the OIG will assess the accuracy of home health agencies' reporting of falls in OASIS. Specifically, the OIG will use Medicare claims to identify hospitalizations due to falls with major injuries among Medicare beneficiaries in home health care. The OIG will then assess the extent to which those falls were reported in OASIS assessments. They will then describe the characteristics of beneficiaries who did not have their falls reported. Finally, the OIG will describe the characteristics of home health agencies that have particularly low reporting rates. This final report is expected in fiscal year 2023. And the fourth and final OIG Work Plan update for May 2022 is titled Audit of the Administration for Children and Families Awarding of an Unaccompanied Children Program Sole Source Contract to Family Endeavors, Inc. Now, this is coming from the Office of Audit Services. The Office of Refugee Resettlement, or the ORR, is a program office of HHS's Administration for Children and Families, or ACF, that manages the Unaccompanied Children Program. In fiscal year 2021, an influx of unaccompanied children began arriving at the U.S. southern border, coinciding with the nation's ongoing efforts to control the spread of COVID-19. As a result, ACF identified a need to increase the number of shelter beds in its provider network and entered into contracts for shelter and related services for unaccompanied children. These contracts included services for a new type of provider facility known as Emergency Intake Site, or EIS. Now, ACF awarded a sole contract to Family Endeavors, Inc., a nonprofit social service agency, to operate as an emergency intake site and provide services for unaccompanied children. Congress has expressed concerns about, and the media has also reported on, ACF's awarding of the sole source contract to Family Endeavors, Inc. The OIG will determine whether ACF awarded this sole source contract in accordance with federal and statutes, in accordance with federal statutes and regulations, as well as HHS's policies and procedures. This final report is expected again in fiscal year 2023. All right, so it's another back-to-back OIG work plan month that's shorter, right? Just like the previous month of April, another short month. So I'm glad the OIG is taking a well-deserved little break in their items on the work plan. But I do think it's incredibly important to realize in these updates that I just provided that our Medicare administrative contractors, those MACs, often have edits that are missed, right? Or simply do not work. And then the overpayment faucet is turned on and the overpayment demands are pouring in. So let's see what happens with post-acute care transfers next year in 2023. And whoa, right? Whoa. The scrutiny is definitely here for those COVID-19 test add-on payments. That's tough to swallow, but let's see if the documentation actually supports the 2-day turnaround time and the use of high throughput technology in those lab tests for COVID-19. My fingers are definitely crossed. So in my opinion, I always pass this detailed information on to my providers who need it to review their coding and their billing practices or their overarching compliance programs. I think these reports with findings are always most interesting and most informative, and I look forward to analyzing them in the years ahead. It's also important for my listeners to please pay attention to these OIG work plan updates to see how they may impact you, your provider, or your health system. So please stay tuned. Even in season 6, the second Wednesday of each month, I drop those monthly OIG work plan updates. And now it's time for my best practice tips in Trusty Tip. So in today's new Back to Basics compliance tip, I wanted to get to the basics of ophthalmology coding. Did you know that these are also addressed in the NCCI Coding Manual? That's again our National Correct Coding Initiatives Coding Manual in Chapter 11. Now it says, number 1, general ophthalmological services with our CPT codes 92002 through 92014 describe components of the ophthalmologic examination. Now, when E&M codes are reported, These general ophthalmological service codes, again with our CPT codes 92002 through 92014, shall not be reported separately. The E&M service includes the general ophthalmological services. Now, number 2, for special ophthalmologic services, these represent specific services not included in a general or routine ophthalmological examination. Special ophthalmological services are recognized as significant, separately identifiable services and may be reported separately. Number 3, for procedures requiring intravenous injection of dye or other diagnostic agents, insertion of an intravenous catheter and dye injection are integral to the procedure and are not separately reportable. Therefore, with our CPT codes 36000 for introduction of a needle or catheter, and our CPT code 36410 for a venipuncture, and our CPT codes 96360 through 96368 for IV infusion, and our CPT codes 96374 through 96376 for IV push injection, as well as selective vascular catheterization codes, are not separately reportable with services requiring intravenous injections. And again, those are for our ophthalmology CPT codes 92230, 92235, 92240, 92242, and 92287. Number 4, for CPT codes 92230 and 92235, those are for fluorescein angioscopy and angiography. These include selective catheterization and injection procedures for angiography. Now, number 5, for fundus photography with our CPT code 92250 and our scanning ophthalmic computerized diagnostic imaging with our CPT codes 92133 and 92134, these are generally mutually exclusive of one another in that the provider and the supplier would use one technique or the other to evaluate a fundal disease. However, there are a limited number of clinical conditions where both techniques are medically reasonable and are medically necessary on the ipsilateral eye. In these situations, both CPT codes may be reported by appending modifier 59 or the modifier XU to the CPT code 92250. Now, number 6, for posterior segment ophthalmic surgical procedures with our CPT codes 67005 through 67229, these include extended ophthalmoscopy CPT codes with our CPT codes 92201 and 92202 if performed during the operative procedure or postoperatively on the same date of service, except when performed on an emergent basis. Extended ophthalmoscopy would normally not be performed preoperatively on the same date of service, with our CPT codes 92225 and 92226. Remember, these codes should not be used anymore. They were deleted on January 1st of 2020. Now for number 7, CPT code 92071 for fitting of contact lens for treatment of ocular surface disease shall not be reported with a corneal procedure CPT code for a bandage contact lens applied after completion of a procedure on the cornea. So, I hope you remember to read, even though this was a small section because our ophthalmology codes are short and sweet, right? But it is included here. So I hope you remember to please read that NCCI coding manual as often as you need to, at least annually, to keep up with revisions. And guess what? There were revisions made to this chapter on May 1st, 2022. So make sure you reread every quarter as it applies to the types of provider clients that you have. I know I do, and it's so very helpful to me to keep staying fresh. And hopefully you are using an online tool that pairs up codes and you can see if there is a CCI edit at play between the two codes, sometimes even more codes, right? And be mindful, ophthalmology is in the crosshairs for CMS and OIG audits. as I'm recording this episode. So it's so important for my providers to stay involved in their coding and their billing practices. It's fundamental if you have Medicare as a payer to keep your eye on correct and compliant coding and compliant billing practices and make sure you are adhering to all of them to ensure that you are meeting the medical necessity from the very start. Because when the documentation paints the medical picture with clarity and with vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, I focus Season 6's Spark on vision and leadership. I want this 6th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for vision and leadership in all we strive to do. So, in this week's inspiring quote, in Spark is from the great Italian artist Michelangelo. The greatest danger for most of us is not that our aim is too high and we miss it, but that it is too low and we reach it. Absolutely true, right? I think this quote inspires us, reminds us that we all should keep going for it. We dream one dream, it comes true. This quote inspires us to keep soaring, to never settle for just that one dream, that one vision. We are all capable of envisioning the very best for ourselves, for our futures, so much more. I am happy Michelangelo's spark still burns brightly in all of us today. So, that wraps up today's episode. And as always, I appreciate you diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead and enjoy all that June brings your way. Please continue staying safe and healthy. Thank you so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.